Hello, stress and acid reflux. That is the topic today we are going to see. So, in the previous videos, we have seen what is acid reflux disease or GERD, gastric reflux disease, and what are the symptoms. The symptoms of acid reflux, usually we secrete almost 2 to 2.5 liters of gastric juice in the stomach. So, the food pipe is up to this level and below that stomach, and this acid should go down. It should not come back again to the esophagus. When it comes back, it's called acid reflux, and the signs and symptoms usually heartburn or dyspeptic symptoms like pain, nausea kind of thing, or even hyperacidity, dry cough, change in voice. These are all signs and symptoms of acid reflux. But one of the reason for there are so many other reasons, like obesity is one reason for acid reflux, or even some medications or reason for acid reflux. But one of the main reason for the acid reflux is stress. So something like stress is like a fire, and acid reflux is like a smoke. So we have to put out the fire, not the smoke. So we have to aim the treatment for the fire, like the root cause. So how stress is a broad term. Most of the people think stress means being unhappy all the time, depressed. That is not. Even if you're doing a job which you don't like, that is a stress. Suppose you have to you are bottom money, you have a loan, you have to pay EMI, then that itself is a stress. So, or even sometimes chronic diseases like even diabetes, it's a stress. So stress, it could be a fear, it could be a panic disorder, anything. So it's a broad term. So what happens is, in the stress, your brain is affected. So your brain is the one which controls almost the whole body, and especially the gastrointestinal tract. So we have a vagus nerve, the longest nerve in the body, which comes from the brain, and it touches all the organs, right from your throat, ear, heart, your lungs, liver, your foot pipe, stomach, everything it touches. So whenever you are stressed, this vagus nerve is stimulated. So what happens because of that? Two things can happen. In the stress, the body is always under the fight or flight mode. So naturally, cortisol, the steroid hormones also increases. So this vagus nerve and your cortisol, they loosen the sphincter. We have a foot pipe, stomach, the junction. There is a sphincter which prevents acid or the reverse flow of acid and food. So this reverse flow is controlled by the sphincter. So your vagus nerve and steroid in stress relaxes the sphincter. So the food, acid, bile, they can come up. So the neutral area of the foot pipe. So when they get the acid, they burn, heartburn. So when it comes to up to the throat level, even you have a dry cough and change in voice also. So this is one way of for the stress can cause lower esophageal sphincter to loose. Number two, delayed gastric emptying time. So normally when you have a food stays in the stomach for digestion roughly around 2 to 2.5 hours, but in stress it stays longer. So the acid, food, everything stays in the stomach for longer time, causing easy escape to the food pipe of the food and acid. The another one is you are under stress, the whole nervous system is is affected, especially the gastrointestinal tract and the digestion nerves are all affected. So what happens? The indigestion happens, the gut motility, your intestine moves very slow, the gastric emptying time is slow, so easy possibility of acid reflux. And very importantly, the last one is you have a hyper acid secretion. So the acid secretion is very high. So when the acid is very high, it has to either go down or up. So now because the lower esophagus is very loose, so it escapes very easily to the chest, causing acid reflux disease. Okay, so how to approach these people? So again, as I told you, stress is the root cause. So we have to be keeping it that mind in a very serious manner. Before that, to alleviate the symptoms, probably your doctor will examine you. He may ask for some tests like endoscopy. Endoscopy will show, confirm the acid reflux, the severity reflux state grades 1, 2, 3, 4 kind of thing, and whether you have a hiatus hernia or some other problem. All these things they can check. And he may even ask for a scan, ultrasound abdomen, to rule out gallbladder diseases, because gallbladder disease is one reason for acid reflux. So these are all they rule out. Once they conclude, it's all mainly because of the acid reflux, is mainly because of the stress part. Probably they will give you initially, to alleviate the symptoms, PPA, proton pump inhibitors, drugs, antacids, to relieve the symptoms, and then come back to the proper treatment, like how to take care of the stress. So probably you may require some help from the family members, or even friends, or even professional help, doctors, psychiatrists, or psychologists, to get rid of your stress. So that is one part. The second part, I always say, good sleep of 7 hours in the pitch dark. That is very important. That can, at least one third of the stress can come down. And exercise is the best stress buster. Any exercise, especially walking, minimum 30 to 45 minutes a day, that can improve your blood circulation, digestion. It's the best relaxing way. The exercise is very important. And of course, if the stress cannot be cured, or, I mean, maybe treated in a medicine way, probably your doctor may prescribe some medicines to take care of your stress. And always, stress is one reason for the acid reflux. And lifestyle change, stress management is almost 90% will cure your problem, and 10% you need some medications and other things. So consult your doctor if you have acid reflux, and is one of the reason is stress. Take care of that. Thank you.